The biggest lies about diabetes that are harming your health. I'm making this video because of a delicate situation that happened today. I had just diagnosed a 9-year-old boy with type 1 diabetes and witnessed a family argument. The aunt and mother were fighting over one of these lies I'm going to explain to you because it seriously complicates treatment. The lie that motivated me to make this video is number 1. That diabetes comes from eating sweets. Let's break this down a bit. Why is this a lie? Well, firstly, type 1 diabetes, like in the case that happened today, is an autoimmune disease, so it has nothing to do with consuming sweets. It's not because you ate some candy or sugar that you'll develop type 1 diabetes. That's completely unrelated. What actually happens is an autoimmune response in your body, meaning your body starts attacking itself, specifically the pancreas. The beta cells in the pancreas produce insulin, so it's actually an autoimmune condition. And it's not because you ate one too many sweets or too few, okay? So this family argument, which can get pretty ugly, wouldn't need to happen if people knew this information. So it's not the mother's fault or the aunt's fault or any family member's fault or even the child's fault, okay? And type 2 diabetes, which accounts for most diabetes cases, isn't caused by eating sweets or sugar. Type 2 diabetes is a multifactorial disease, and one of the main causes, or perhaps the primary cause, is obesity. Fat tissue interferes with insulin action, leading to a condition called insulin resistance. Your body produces insulin, often even in excess, but this insulin can't do its job properly. There are other factors too, like a sedentary lifestyle, poor diet, unhealthy habits, not getting enough sleep, and lack of a regular routine. Genetics also play a role in these cases of type 2 diabetes, but eating a sweet doesn't mean you'll automatically get diabetes. Otherwise, everyone who ate a sweet treat would develop diabetes, and we know that's not exactly how it works. But why do so many people say this? This is one of the most common misconceptions. We need to understand why this happens. After you've already developed type 2 or type 1 diabetes, if you eat sweets, your blood sugar will increase. So it's not that sweets are completely off limits, but you should limit your consumption. Once diabetes has set in, once you have this condition, that's when you'll need to avoid sweets, because they will indeed worsen your glycemic control, your blood sugar control. Got that misconception cleared up? No arguments about this anymore, right? I hope those people are watching this video. And misconception number 2 is about physical exercise. Have you ever heard that physical activity increases blood glucose? This misconception can seriously harm your health. You see that in the title I put, Deadly Lies About Diabetes, because they can really make diabetes control much worse. Let's understand where this misconception came from and why it's not actually true. The idea that physical exercise increases glucose levels arose because immediately after intense, rigorous exercise, due to increased levels of adrenaline and even cortisol, depending on the type of physical activity you do, you might experience a brief spike in blood sugar levels. This is true. However, in the long run, this is actually very beneficial. Why? With physical activity, you reduce body fat, increase muscle mass, and improve your metabolism, particularly how your body processes blood sugar, because muscle tissue is a great ally in controlling diabetes. So even if your blood sugar levels rise a bit right after exercise, you shouldn't worry about it. Why? Because in the medium and long term, it's very beneficial and you should definitely engage in physical activities. I hear this all the time in my office, people saying they can't exercise because of their diabetes. It's been scientifically proven that physical exercise greatly helps in controlling diabetes. In fact, it's one of the main pillars of diabetes management. And the third widely spread myth is that type 2 diabetes is a lifelong condition. Why is this a myth and where did it come from? Let's understand that in many cases of type 2 diabetes, you can actually reverse this condition. It's not just me saying this, it's the American Diabetes Association. So what's the criteria for reversing type 2 diabetes? If you maintain your glycated hemoglobin levels below 6.5 for a period of 3 months or longer after your doctor has discontinued your medications, that's considered a criterion for reversing type 2 diabetes. Now, if it's type 1 diabetes, that is indeed lifelong. As of now, there's no cure or reversal, only management of blood sugar levels. And lie number 4 is about false promises, those miraculous diabetes cures that seriously harm your health. In my practice, I've seen many diabetics who have fallen for these scams. So let me be clear. There's no tea, supplement, or vitamin that can cure diabetes. It simply doesn't exist. What does exist are various actions and lifestyle changes you can make to control your blood sugar levels. It's not easy, and there's no hidden cure despite what some people claim. It's not some conspiracy by doctors or health professionals to keep you from discovering a cure. So don't believe this for a second, and don't buy any supplement or tea thinking it'll cure your diabetes. Number 5, and I hear this lie often too, which can have serious consequences for your health. I don't have symptoms, so I don't have diabetes. And why is this a lie? Because in the early stages, especially with type 2 diabetes, you can have changes in your blood sugar levels. You might even experience complications from diabetes. Often you already have heart damage due to increased blood sugar levels, and you don't have any typical diabetes symptoms, like excessive thirst, weakness, or waking up frequently to urinate. You might not be losing weight or experiencing any of those classic diabetes symptoms, because those only occur when your blood sugar levels are extremely high, okay? So, routine fasting, blood glucose tests, and diabetes evaluations should be done regardless of whether you have symptoms or not. And if you already have diabetes, you should also get regular checkups because of this, as often the first symptom could be a heart attack or a stroke, also known as a CVA. So just because you don't have symptoms doesn't mean you don't have any changes due to diabetes, or that you don't have diabetes at all. Lie number 6 is that diabetes medications can cause dependence and tolerance, and that over time you'll need to increase the dose because they'll stop working. Why is this harmful to your health, and why is it a big lie? Well, let's break it down. Various medications work on specific issues. For example, metformin, which is the most widely used diabetes medication in the world, works by improving insulin resistance in your body and liver. As a result, your body will be able to use insulin more effectively, working more efficiently to improve blood sugar levels. However, if you don't make lifestyle changes, the disease tends to progress. But it's not because of metformin or the medication you're taking. It's because you haven't made the necessary lifestyle changes, which can actually reverse this insulin resistance situation. So don't be afraid if your doctor prescribed medication, because this myth exists due to the fact that most people end up not doing the most important thing and just focus on the medication. Now, did you like this video? On a scale of 0 to 10, how would you rate it? If it's a 10, I'll make more videos like this one. Leave a comment telling me which part of the world you're from, which city or country you're watching this video from. Now I'm going to recommend a video for you to watch. It's one where I talked about fruits for diabetics. Did you know that there are fruits that are bad for people with diabetes? And there are fruits that are very good and can help control blood sugar levels. Want to know which ones they are? I talk about that in this video here.